My name is Sarah Mackay, and this is my PhD story. We know that roughly about 30% of adult inpatients have malnutrition, and about a quarter of long-stay patients in hospital develop malnutrition, or their malnutrition status gets worse during their hospital stay. And the implications of that are huge. They end up staying in hospital longer, they're more likely to get readmitted, their mortality rate is higher, the risk of pressure injuries and falls and all those other things are really much more likely to occur if a person is to have malnutrition. So within Queensland Health, we do what we call a statewide malnutrition audit, where we ask patients, if they remember anything about being informed about their nutrition diagnosis or anything about their nutrition care plan in hospital. And the results from that told us that most patients don't really know what their nutrition status is, and they don't really know about what's happening for them in hospital from a nutrition perspective. And we know that there's lots of different factors that could be influencing why that's the case. But one of them that really came to light and we were discussing a lot between colleagues was about if patients really understand what malnutrition is. And then we also didn't know whether different members of the multidisciplinary team in hospital were talking to patients about their new malnutrition diagnoses as well. And so we went and started to explore the literature and realised that there's not really anything out there around the terms and communication of malnutrition, which is what really then led me to starting my research journey.
So clinicians are at the forefront of treating patients, and their ideas often come through their working with the patients, and they have these ideas of how they can improve patient care, and we can bring those to life through our support.
So I work full-time as a dietitian, and so I'm a couple of years into my PhD now, but I guess I've been doing all of that work in my own time, which is really tricky, and it can make progress really slow. So the scholarship really, it allows me to have some time away from my clinical dietitian position, so I can have dedicated time to work on my PhD. It just makes it so much more feasible, a lot more manageable for me, but I also hope from a time perspective too, it means that things can happen a little bit faster as well. So I'm really fortunate to have some consumers, so previous hospital patients on my research team, and I feel that without this scholarship that wouldn't be possible, and they bring such amazing insights that I otherwise wouldn't have thought about. I guess I would hope that from a patient perspective is that when they have a diagnosis of malnutrition, that they are aware of that. They know what that means for them, and they can make really informed decisions about how they want to go forward and manage that condition of malnutrition. And I would also hope that from a health worker perspective, whether that be dietitians, doctors, nurses, that people know about different factors that they need to be considering about when they communicate a malnutrition diagnosis to a patient, and really how they can go about communicating that too.